Hello, in this video I'm going to talk about a very important bone which is known as the occipital bone. So I'll outline it on this skull. So the occipital bone is located at the back of the head, and it is as shown in on this specimen. So all that is part of the occipital bone. So all this area is part of the occipital bone. And it is generally described as a flat bone, although from the look of things it looks more of an irregular bone than flat. But because most of the parts that constitute the occipital bone look somewhat flat, this part also looks flat, so it is generally regarded as a flat bone. So this is an unpaired bone. Normally in the adult it's unpaired, but in the young animals it may look as if it's paired because the joints have not yet ossified. So it's an unpaired bone that forms a major part of the posterior wall and the base of the skull. And it is a complex structure that protects the cerebellum, which is part of the brain, and also it protects the occipital lobes of the cerebrum. It also acts as the connecting pathway from the brain to the spinal cord. So normally the medulla oblongata would transition into the spinal cord after imaging through this hole here, which is called the foramen magnum. We'll mention it subsequently. So the occipital bone is located at the posterior part of the cranium, huh? And it forms the rear walls of the vault, which is the part of the cranial cavity, and also it forms the floor of the cranial cavity. The ventral part of the occipital bone is perforated by a large foramen, which is known as the foramen magnum, through which the spinal cord passes. So this is the foramen magnum. So it is bounded by these two structures, which are the occipital condyles. The foramen magnum marks the junction between the cranial cavity and the vertebral column. So this is where you have that demarcation between the cranial cavity and the vertebral column. Then the occipital bone has three parts. It has three parts, and these parts are the squamous part, which is this region here. That's the squamous part of the occipital bone. And it is good to use this young skull because it still has the sutures visible, which can easily, be used to show the different parts of the different bones, including the occipital bone. So the first part is known as the squamous part, which is located dorsally. So that's the squamous part of the occipital bone. And then you have the lateral parts. The lateral parts are two. There is this part and also that part. So these are the parts that bear the occipital condyles. So then you have the last part, which is the basilar part, which is located ventrally. So the basilar part is this part here. That's the basilar part. So in short, the occipital bone has three parts. There is the squamous part, which is shown there. Then there is the two lateral parts, which are basically regarded as one. So you have on the left and on the right. Then finally, you have the third part, which is the basilar part, which connects to the sphenoid bone cranially there. So the squamous part has the nuchal crest. There is a structure known as the nuchal crest. This is the nuchal crest. This is a region of the nuchal crest. It's not very prominent in the goat skull, but you can see it clearly in other skulls, such as the cows and the horse. So the squamous part has the nuchal crest externally, and this in adult animals attaches the what is known as the nuchal ligament. There's a ligament that attaches to this nuchal crest. Okay, and this saves the nuchal ligament saves to sustain the weight of the head of the animal. So as the animal is feeding, the head normally goes down. So in order to relieve pressure from the muscles of the neck, the nuchal ligament is engaged in actually sustaining the weight of the head. Then the lateral parts of the occipital condyle, or rather of the occipital bone, bear the occipital condyles. So these are the lateral parts, and they bear the occipital condyles. Okay, and these occipital condyles articulate with the atlas. The atlas being the first bone on the cervical vertebrae. So that's the number one cervical vertebra, C1. So these two structures will normally articulate with the atlas. Then the basilar part, which is this component here. So the basilar part extends anteriorly or rostrally, and it extends from the floor of the foramen magnum, and it attaches to the posterior aspect of the sphenoid bone. The sphenoid bone is here. So you can see a joint there between the basilar part of the occipital bone and also the sphenoid bone. So there is that contact between the basilar part and the posterior part of the sphenoid bone. Then lateral to the condyles, these are the condyles here. So lateral to the condyles, you can one can see the some pointed structures, two pointed structures. You have this structure here, which is sharp, pointing ventrally. Then there's another one here. Of course, on this specimen, this structure here, and also that structure. On the other side, on the right side, it has broken off. These are what are known as the paramastoid processes. These are the paramastoid processes. So there are two. There's one on the left and one on the right. And these are just blunt bony prominences which project ventrally. Yeah? They serve for attachment of some important muscles as well. Then finally, the occipital bone articulates with other bones as well. It articulates with the parietal bone. Okay, so we have the parietal bone there articulating with the occipital bone. And also the interparietal is a small bone that has fused with the parietal bone. We cannot see it in here. Then also the parietal bone there, and then the temporal bone there. It also articulates with the temporal bone as well as the squamous temporal bones. So you have a number of bones articulating with the occipital bone. We have the parietal bone there articulating with the occipital, specifically the squamous part of the occipital bone. And then we also have the temporal bone articulating there. So those are the brief notes on the anatomy of the occipital bone. Thank you for listening.